Welcome. Tonight we talk about a pillar of health that most people forget. Yet it controls healing, it controls energy, and it also controls peace. We will look at why food and exercise alone are not enough. I'm Dr. Joshua Nderitu, a family physician. I have interest in public health and cancer prevention and treatment. Nancy was a 38-year-old lady, and she presented to the healthcare, having been seen in quite a number of facilities with this persistent general body discomfort, unexplained pains, and she couldn't really tell what exactly was wrong with her. Many tests had done, her thyroid, her kidney functions, her liver functions, and everything seemed to be okay, but she completely felt unwell. So, you eat well, you exercise, you still get very tired, you still feel very stressed, you still feel sick. So many people feel they are doing the right thing, but still they feel unwell. And tonight we are going to look at what are some of the things, this third pillar of health that is so critical. If not taken care of, will make you have all these symptoms. You will learn why food and exercise are not enough. We will look at this third pillar of health and why it is important, looking at the science behind it, and we'll also look at what happens when this pillar is weak. And then we are going to look at simple actions that you can start tonight and be able to discuss and be able to manage this third pillar of health. So we are going to look at science-based evidence of the importance of this third pillar. You might feel you are doing everything right, but you are still not very well. I see patients who eat well, they exercise, yet they have fatigue, they have pain, they have poor sleep, and even they are stressed and they feel overwhelmed. Tests are normal, but something is missing. Something that is very critical. So why are food and exercise not enough? The brain controls sleep, it controls hormones, it controls your stress, and it also controls your healing. And when your brain is tired or stressed, then your body cannot recover. So poor sleep and the chronic stress are linked to higher blood pressure, higher blood sugar, lower immunity, heart attacks, and even cancer risks. And it has been shown that if you don't sleep adequately, then you also have the risk of getting obesity. And it has also been shown that patients who don't sleep adequately, there is evidence that they may have cardiac arrhythmias. So these associations shown research. It is not my opinion. So this third pillar, we look at it is rest and mind regulation and sleep. So sleep will help you control stress. It will control your emotional health and also your mental health. And even when you are stressed, if you don't get enough sleep, it affects your performance. It has been shown that people would not get adequate sleep, especially when they work with machines. They are likely to cause more accidents, and even when they drive, they are likely to cause more accidents. So these holiday seasons, if you want to really be safe, then ensure that you have restorative sleep so that you can function to your optimum. So good sleep makes sure that your brain repairs, it balances your hormones, and it clears your waste. and it builds your immunity. So poor sleep is linked to high blood pressure. It is linked to diabetes. It is linked to memory problems and even more cases of accidents. So lack of sleep is not laziness. Sleep is medicine. And if you are a student and you are learning, if you really want to improve your memory, if you really want to improve your understanding, then the medicine and the cure to your lack of understanding is sleep. So sleep inadequacy is related to stress and it puts you in danger mode. So chronic stress keeps your body in danger. The blood pressure stays high, your sugar stays high, and then even the inflammation is high. What this means that when you have high inflammatory response, you are likely to have more stress, you are likely to have more risk of getting infections. And also, as I've said, you are at more risk of causing accidents. So healing needs a calm mind, needs a rested mind. And sleep is not just rest. It is when your mind repairs, it is when your mind reorganizes, and it even removes the toxic chemicals that are associated with atherosclerosis. This is the process where the blood vessels narrow. So sleep is not just rest, it is restoration. The body cannot heal when it feels unsafe, and sleep makes you safe. So if you really want to get adequate sleep, then you need to calm down and you need to have a sleep routine that will help you to restore your mind. Some of the things that you can do to help you relax and be able to enjoy a good night's sleep is practicing breathing exercise, like the 60-second breathing exercise, where you inhale with your mouth for about 4 seconds. Then you hold your breath for about 60 seconds, and then you breathe out with your nostrils at about 8 seconds. This helps you to calm down, and this helps you to be more alert. So when you don't sleep adequately, what happens? You get a headache, you get back pain, you get fatigue, you have feelings of anxiety, and then, of course, sleep itself becomes unfulfilling, and you wake up very tired. So this tells you that there is something that is not right with you. And when you go to the doctor, your blood test will be normal. Uh, Medicine will help very little, but restoring your sleep is what will heal you. So when you have this, you know that your sleep is not adequate, then that is what you need to address. So having inadequate sleep makes you wake up tired. You are not well wired at night. You have a racing mind that is not rested, and then your sleep is broken, and you are always tense. So when you notice these things, one of the things that you need to ask yourself, am I sleeping enough? Is my environment for sleep adequate to keep me adequately sleep? So what are some of the things that you can do to protect your sleep? One is developing what we call the sleep hygiene practices. What do these sleep hygiene practices encompass? It means having a same sleep time and the same wake up time. This includes even during the holidays and even the weekends, because your mind works on routine. And as I've talked before, it is easier when you build systems, then your body becomes used to it, and your body relies on systems to function to its best. So when you have a specific wake up time and a specific sleep time, then your mind adapts to that, and you do not have difficulties. Then there is also the issue of uh, aligning your sleeping time and your waking up time with your sleep circadian rhythm. We go through two types of sleep patterns: the rapid eye movement sleep and the non-rapid eye movement. So when you wake up in between any of these cycles, then you may wake up feeling disturbed and feeling like you have not had enough sleep. So you need to align your sleep pattern with this circadian rhythm so that your sleep is refreshing. If you wake up in the middle of the cycle, then you wake up tired, you wake up feeling unfulfilled, and you feel like your sleep is not satisfying. Then the other thing that you need to look at is the issue of using electronics before bedtime. You need to really have a switch of time, 60 minutes to sleep time. You should switch off all your electronics. The brain does not differentiate between the natural light, the light from the sun, whereby when the natural light is on, then your mind knows it is wake up time, it is work time. Electronics have what we call blue light, and it is same wavelength as the natural light. So when you expose yourself to the phone, to electronics at night, then you make your mind activated and you have difficulties sustaining sleep. Then it is important that you avoid stimulants 3 to 6 hours before your sleep time. Things like coffee, any of those stimulants, even alcohol, because yes, sometimes some people will say that alcohol will make you sleep better. And in this sense, it does make you sleep better. But it only sedates you, but it does not, it disrupts that circadian rhythm of your sleep. So that when you sleep with assistance of alcohol or even medications, you wake up, yes, you have rested, but you are waking up tired, feeling that you have not had adequate sleep. And this will be detrimental to your sleep. Then the other thing that you need to observe is your sleeping room. Make it dark, make it cool, make it quiet. When your room, the temperatures are high, then having higher temperatures in your bedroom is associated with poor sleep. Your body temperature needs to cool down so that you can enjoy good night's sleep. And then having rituals that you observe before sleeping. Getting to sleep is not like a switching a light off. Getting to sleep is like stopping a Boeing 747. There are several procedures that you need to follow so that you get into sleep adequately. You may need to take a shower. You may there are those people who calm down by taking a hot drink, and it helps them to calm down so that whatever issue or routine that you establish, then establish it and make it a system that your body identifies that now it is time to sleep. You can read a book, you can do some yoga for those who know how to do yoga, you can do some meditation, or you can just do gratitude journaling, and then also trying to plan how you believe my tomorrow be. Uh, Practicing gratitude helps your mind to settle down. What are the things that have happened today that I'm really grateful about? You can pick 3 things that you are grateful about and then try to set what you will do tomorrow. This helps your mind to know that your tomorrow is well established and things that might be disturbing your mind are taken care of so that you don't sleep with very disorganized thoughts. If you sleep like that, then your brain will keep working on them and you have difficulties getting into sleep. Of course, the thing I also encourage you is not to have a phone in your bedroom. I always say that a bedroom is a place for sleep, not for scrolling. So try to keep your alarm away from your bedroom. And if you have to use a wake up opportunity clock, then have the national ordinary clock that you just use the alarm, not the phone, because sometimes the phone can be tempting. You want to scroll, and if you have difficulties with sleep, if you have a phone as your wake up opportunity signal, then you get distracted in the middle of the night and you may start scrolling. So those are some of the things that you can do to protect your sleep, and this will help you sleep adequately. So start with slowing down, taking a breath. One of the other important things that you can do and helps reset your mind is exposure to the natural light. When you wake up in the morning, around 10 when the sun is not very hot, exposing your eyes to the natural light, to the sunlight, helps your body and your mind to establish that circadian rhythm. And when it comes at night, you are setting the routine for your breath. Of course, avoiding heavy meals just before time. So because when you sleep with a full stomach, then most of the blood that you have goes to digestion, and this will affect the way you feel. It will affect the way your sleep will happen, and this will make you have disturbed sleep. You may even have nightmares because most of the blood is going to digestion. Then, of course, having daily exercises or taking a walk 10 minutes after meals will help you to absorb the glucose in your body, and this will help your mind to relax. So these actions heal the brain, calm your brain, and they improve your healing. So what are some of the things that you can do and establish that daily routine of sleeping, actions that you can take and start implementing and putting them in your daily schedule? You can do prayer, as I've said, have a routine of praying, possibly just before you tune down, doing some meditation and just having some meditation. 5 minutes is enough to calm your mind and to heal your mind. So stillness is a powerful medicine for your brain, and it helps you to relax. Then you can do gentle stretches. You can do a slow walk. You can need something that is calm. If you again listen to something that will stimulate you, then or something that you find very interesting, and that's something that is very absorbing, then you find that you have difficulty getting into sleep. So slow evenings leads to better sleep, and this makes you wake up feeling energized and feeling in better control. So from these discussions, what are some of the things that you can pick that you would want to put into practice? You can pick 2 actions, put them in your calendar, track them daily as you practice them, and then see how your sleep changes, or how you improve your sleep improved. So if you do not have time to do some of these things, there is something we call habit stacking. In one of my talks about habits and system, you can do habit stacking. It is building a habit on something that you already used to do. For example, if you are used to brushing your teeth before you sleep, so you can stack the habit of prayer and the meditation to your brushing. Before, after you brush, you know that I'm going to do a meditation or I'm going to do a prayer. If you have a wake up schedule, then anchor some of the activities to your wake up uh, time. Then, of course, adjusting your bedroom so that it is dark, it is has no noise, and then trying as much as possible to remove electronics from your bedroom, and then also ensuring that you set routines of what you practice before you get to sleep. So having these routines, knowing that your sleep is important, prioritizing your sleep will help control your blood pressure, will help control your weight, will help you remove belly fat, which is associated with 13 types of cancer. And we say that adults require 7 to 9 hours of restorative sleep every night. Adolescents require between 9 to 10 hours of good and disturbed sleep, and also making sure that the sleep is uninterrupted. This will help you to wake up refreshed, and also it will help you to remove anxiety, to remove depression. It has been shown that people who do not sleep adequately, they are more likely to be anxious, they are more likely to be disturbed, they are more likely to have mental disturbances, because sleep helps you stay calm, stay controlled, and inadequate sleep makes you wake up feeling depressed and also feeling overwhelmed. So for you to stay healthy, then prioritize your sleep, uh, treat it like medicine, and treat it like your life depends on this, because it does. So you don't heal by pushing harder, you heal by resting better. And if this message has touched you, share it with another person. Also, follow the Overall Health YouTube channel at Dr. Nderitu for more health insight. Remember, this information is for education only. For more personal advice, see your medical provider. And also, if you need any health help at a personal level, you can always visit us at Wellness Health Services Medical Center, or you can consult. We do online consultation, and also you can join the Health Insight 360 coaching program. This is a coaching program that is meant to help you incorporate the lifestyle practices. We talk about the 7 pillars of health. This is the third pillar of health. Next Sunday, I will be talking about the fourth pillar of good health. And so I welcome you same time, same place, so that we discuss this fourth pillar. And if you join this program, then you'll be able to understand the 7 pillars, and not only understand them, but incorporate them into your life. And if you incorporate them into your life, you will be able to manage your weight. You'll be able to manage the diseases of lifestyle like diabetes, hypertension. And if you are more keen, you can even reverse diabetes and be able to control your blood pressure with lifestyle changes. So if you want to live longer, live healthy, we are not talking about preventing diseases, but we're talking about creating health through your lifestyle. Because if you change your lifestyle, then you are going to not only have a lifespan, but you are going to have a healthy span. What is a healthy span? Is that you age without having these chronic diseases like diabetes, hypertension, arthritis, and developing belly fat, getting the risk of cancer, and then you have also the uh, the cancers associated with obesity and even conditions like arthritis. Thank you very much. Subscribe to the Overall Health at Dr. Nderitu, and then start your 7-day reset. Start something tonight that will make your sleep better, that will make you live better and enjoy a healthy life. Thank you.